Hi guys, my name is LaDonna Cavanis and I am an instructor here at Ultimate Medical Academy. Today we are going to be learning about medical terms. I've created a PowerPoint presentation for you guys because I would like to go over some learning objectives. So when we talk about medical terms are used throughout the healthcare industry. It is considered the language of medicine. Medical terms can be broken down into one or more word parts. There are a total of 5 different word parts, and any given medical term can contain one, some, or all of these parts. So let's get started. Let's take a look at prefixes. A prefix appears at the beginning of a word and generally describes location and intensity. Prefixes are frequently found in general language such as autopilot, submarine, tricycle, as well as in medical and scientific terminology. When a medical term, ventilation, contains prefix X, hyper, the meaning of the word is altered, hyperventilation. Not all medical terms have prefixes. By learning to recognize a few or more commonly used medical prefixes, you can figure out the meaning of these terms that may not be immediately familiar to you. Let's go to the next one. Let's talk about word roots or root words. This is the main part or the stem of the word. A word root conveys the essential meaning of the word and frequently indicates a body part. With a combining form, the word root and a combining form or combining vowels such as I, E, or O, or may be combined with other root words, a prefix X or a suffix X to describe a particular structure or condition. A frequently used term in EMS is CPR, which stands for cardiopulmonary resuscitation. When we break it down, cardio is the root word meaning heart, and pulmonary is the root word meaning lungs. By performing CPR, we introduce air into the lungs and circulate blood by compressing the heart to resuscitate the patient. All right, let's go to the next word. Let's take a look at suffixes. Suffixes are placed at the end of the word to change the meaning. In medical terminology, a suffix usually indicates a procedure, condition, disease, or part of speech. A commonly used suffix is itis, which means inflammation. When this suffix is paired with prefix arthro, meaning joint, the result is arthritis, an inflammation of the joint. Sometimes it is necessary to change the last letter or letters of the root word or prefix when a suffix is added to make pronunciation easier. All right, let's take a look at combining vowels. When we talk about combining vowels, um, it's usually the letter O, and it may be added between a word part to add pronunciation. Let's take a look at combining form. A combining form is simply a word root with a combining vowel added to the end. Example of this would be GASTR. With the combining vowel added O, we create gastro. All right, so I have some examples here. Let's take a look at endocardium. When we break it down, the prefix is endo, the root is cardi, and the suffix is um. Endocardium. Here's another example. Cardiologist. Cardi is the word root, which means heart. Okay, so when you break that down, cardi is the prefix, O is your combining vowel, and logist is your suffix. And remember, guys, the foundation of any medical term is your word root. Here's another example. Suffix, cardiogram. So when we break this down, the root is cardi, the combining vowel is O, and the suffix is gram, G-R-A-M. Here's another example, guys. Megalocardia. When we break that down, the root is mego, the combining vowel is O, the root is card, and the suffix is I-A. I want to talk to you guys about common abbreviations used throughout the healthcare industry. Abbreviations take the place of words to shorten notes or documentation. When you are using abbreviations in patient care reports, progress notes, remember to use only standard acceptable abbreviations to avoid confusion and errors. List commonly used abbreviations only. The list is intended to help you decipher documents written by other healthcare professions. Before using any abbreviation in your report, you should be familiar with accepted abbreviations in the local jurisdiction of your area. Now I want to talk about anatomical planes. Another part of being a good healthcare profession is to have a good understanding of anatomical positions and planes. Anatomical terms are made up of root words, prefixes, and suffixes. The root of the term often refers to an organ, tissue, or condition, whereas the prefix or suffix describes the root. For example, in this common disorder, hypertension, the prefix is hyper, which means high or over, and the root word is tension, which refers to pressure. So that the word is hypertension, which refers to abnormally high blood pressure. Using standard anatomical terminology ensures that doctors have a common method of communicating and to avoid confusion when identifying structures. It enables you to describe the location of structures in relationship to other structures or other locations in the body. Here's some examples of different anatomical sites and their definitions. A good tip, guys, when I'm studying for tests and exams that require me to use medical terms, I use flashcards. Flashcards are a great option for visual learners. Cards can give you a visual cue to connect with the medical terms that you are learning. When you learn the common prefixes, suffixes, and word roots, you have the tools to combine hundreds of medical terms. I would like to thank you guys for joining this presentation on medical terms. Thank you.